genetic testing can provide you with valuable information about your health, potentially explaining concerns that you already have and helping with the management of those concerns, or sometimes even learning about predispositions to possible other health risks in the future and things that we can do to help mitigate or address those increased risks. And that's something that we see a lot in the cancer world. We're able to do some testing to kind of see if there's any sort of genetic predisposition to cancer, and oftentimes there's some pretty concrete steps that can be followed to address those risks. So when a change is found in genes associated with an increased risk for breast cancer, there can be some different routes available to address that. And sometimes those recommendations may vary depending on the level of risk that is associated with that specific finding. Most of the time, I think the most common approach is to offer increased breast cancer screening. And so typically that looks like starting your mammograms at a younger age and also doing additional screenings like breast MRIs and doing them at a higher frequency. So typically the recommendation is you do a mammogram and an MRI about 6 months apart, and you alternate between the two of them. And so that way you're getting both sorts of imaging, because we do know MRIs are more sensitive than the mammograms. And so we like to really make sure we're looking, and we like to make sure that they're not going more than 6 months without some sort of imaging or screening being done.